Let's have a short look to the monitoring of the gluten-free diet in celiac disease. It's not only the diagnosing, it's to the monitoring of the compliance of the patient to this nutrition therapy. Another tool is the antibody testing. Here you have the different types of transglutaminase antibody testing, the tissue transglutaminase, the epidermal, and the neural transglutaminase. You should always test for tissue transglutaminase because it's the basic diagnosis for celiac disease and can clearly monitor the adherence to the gluten-free diet for several weeks or months. The others, ETG and NTG, can be tested with skin symptoms or if there are neurological symptoms. To see whether the patient was compliant to the diet in a very short time frame, you can use the determination of the gluten immunogenic peptides, shortly GIP. If you test in urine, you have a window of opportunity of about several hours to 1 day, where you can detect a gluten intake with diet. That can be done when the patient comes to the doctor's office with acute symptoms. Then you can see whether there was a contamination in the diet. Routinely, you should test for GIP in stool. That shows you whether the patient was compliant for about 1 week. Here you can see that in the short-term compliance, the patient adheres to the gluten-free diet. If there are results which show you that there is an increase in antibodies or elevated GIP in stool apparent, then you should go to a nutritionist and do education. GIP are also good to discriminate between a bad diet compliance and a refractory celiac disease, which is a very rare but very severe form of celiac disease. This disease can only be confirmed with biopsy, and this should be done if there is a strict adherence to gluten-free diet, but still asymptomatic. The takeaways for diagnosing are that if there is a therapy refractory anemia of unclear etiology, you should test for celiac disease. This is a strongly recommendation of all guidelines. The next is osteoporosis, osteopenia, and osteomalacia may result from malabsorption and can be a consequence of undiagnosed celiac disease. Even then, you should initiate a celiac disease diagnostics. And the third is neuroceliac disease. You should be aware that early diagnosis based on anti-TTG and anti-NTG titers can avoid irreversible physical and mental impairment. And our goal is to early detect this disease. And finally, for the therapy of celiac disease, the nutritional therapy is very effective. We can not only heal celiac disease in the gut, but we can additionally heal all other signs of malabsorption or diseases like anemia, osteoporosis, or neuroceliac disease. Trust is good, control is better. You never know how compliant your patient is. And success control is the basis of a gluten-free diet. It should be strict, without any gluten intake or contamination. With GIP monitoring, you can detect long-term and short-term compliance of all your patients. And finally, celiac disease diagnostics and monitoring can be performed in any medical laboratory. we have the tools present, the ELISAs for the detection of anti-human tissue transglutaminase IgA, anti-human epidermal transglutaminase IgA, or anti-human neural transglutaminase IgA to detect gastrointestinal, dermal, and even neural manifestations of celiac disease.